If you followed my work, you know that I consider omega-3 fish oil to be an indispensable part of my daily regimen, and that I've recommended it for my patients and followers for decades. If you're already taking omega-3s, you should know that I've discovered a product so special that it's become my go-to brand. Dr. Jeffrey Bland, one of the luminaries in the world of complementary health, takes omega-3s to a new level. Omega-3 Rejuvenate from Big Bold Health is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. Unlike most other brands, Omega-3 Rejuvenate does it differently. The product comes straight from the sea into the hands of skilled fishermen, instantly flash frozen, and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique process preserves the natural goodness of the fish, so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman20 for 20% off site-wide. Welcome back to today's Intelligent Medicine Podcast. It's our weekly Q&A with Leyla. Boy, I really look forward to every week when we get your excellent questions and comments. And we have a chance to riff off of them with my favorite interlocutor, who is Leyla Muedin. And so just a little bit of an update, because I was pretty proud of myself for remembering about the Shoot brothers, because they were around kind of in the 80s. And they were the vitamin E guys, but I just looked it up because this is like Google is my auxiliary brain these days, and I gotta offload some memory to an outside device.
Yeah.
So here's Neville Shute is the guy who wrote a apocalyptic novel about a nuclear holocaust, and it takes place in Australia, and the Northern Hemisphere has obliterated itself, and the radiation cloud is inexorably approaching Australia. And the whole thing takes place in Australia, and it's the kind of thing that, I grew up with in the 60s that made us scared. That and, Dr. Strangelove and, all those kind of movies, right? Mm-hmm. So that's not... So it wasn't Neville Shute. There were 3 Shute brothers, not 2 Shute brothers. Evan, Wilfred, and Wallace. They were Canadian physicians based in London, Ontario, who became pioneers in the use of vitamin E for treating cardiovascular disease. Starting in the 1940s, they ran the Shute Institute and advocated for high-dose vitamin E therapy, making significant, albeit controversial, contributions to nutrition-based medicine. So what we have to say is that maybe we should apply a little bit of a correction to that. Because there's evidence that maybe we should be rethinking high-dose synthetic vitamin E.
Yes, which is different than the real thing. Yeah.
But I got to say that I think it's still got some mojo. In this study that I'm looking at here, is that they still say there's evidence that vitamin E is protective against the development of atherosclerosis. Vitamin E helps to retard LDL oxidation. You want to explain what that is?
Yeah, LDL oxidation. That's the oxidation of the so-called bad cholesterol, causing it to become a plaque, causing calcification in coronary arteries. And vitamin E is an antioxidant.
Yeah.
So it helps with that. Yeah.
They say it can inhibit the proliferation of smooth muscle cells, which form atherosclerotic lesions, inhibit platelet adhesion, because it is a little bit of a blood thinner, and aggregation, and inhibit the expression of adhesion molecules, sticky molecules. It has a little bit of a anti-inflammatory effect, and yada,
it's nice for skin.
Yeah.
It's nice to help with preventing scars, possibly. Putting some vitamin E oil on a scar or something like that. Vitamin E is good. Yeah.
Yeah, I have to say sometimes there's a little bit of a pounce element to when they look at certain vitamins or supplements and they
Agree.
delightedly provide evidence that they don't work or that they're harmful. And
Mm-hmm.
I think we have to take a more balanced approach to it. And
Mm-hmm.
I'm not ignoring evidence from studies that suggests no benefit or some adverse effects, but
Mm-hmm.
it doesn't mean we need to throw the baby out with the bathwater.
Exactly. Exactly. Okay. Let's see. We've got a question from Tony. Hi, Dr. Hoppen. Please clarify for me. Many have cautioned to stay away from sulfates, parabens, fragrances from shampoos, soaps. When I look at the ingredients on shampoo specifically, I find dozens of ingredients. I recognize sodium lauryl sulfate as a no-no, but even those marked free from sulfates and all of that, there are other things in there. Please explain what I should be avoiding. Thank you, as always, and for your guidance, a long-time listener. There's a lot there on those ingredient labels.
Yeah.
So,
Uh,
and it can be hard to decipher.
I can't keep track of all the harmful
Yeah.
ingredients. So what I do is I use a reference source,
Yes.
which is EWG, the Environmental Working Group, has a section on
.org.
cosmetics and
Mm-hmm.
the so-called dirty dozen of among the ingredients that you should look to
Right,
avoid.
right. Yeah, Dirty Dozen, Clean 15, they talk about fruits and vegetables. With regard to cosmetics and things, EWG has another link to safecosmetics.org.
Oh,
That's
thank you.
safecosmetics.org.
Mhm.
And it literally rates them. It tells them what is risky, what is not risky, what really to
Yep.
avoid, what you could probably safely use, and so forth and so on. It goes through a lot of those particular brands. So
Yep.
even if you're looking at a particular brand of shampoo, you could look for it there and see what kind of a rating it gets with regard to risk benefits.
And that's
And
important for all of us, but it's particularly important if we
yes,
say get a patient who's recovering from cancer, they've had successful cancer surgery and treatment, but
yeah,
we tell them that they want to adopt an anti-cancer lifestyle. And it's not just,
yes,
eat a certain way or take supplements. It's about
hmm
sleep and exercise and, appropriate circadian rhythm, sunlight
yeah,
exposure, but also
and
avoidance
reducing.
of environmental toxins. Yeah.
Absolutely. Absolutely. And you have to control what you can in your environment with your shampoo you're using, your soap, your personal grooming products for ladies, your makeup, all of that kind of thing. So you want to be able to control the toxic exposures in your microenvironment. So go ahead and do that. You're doing that with your food, even with your cleaning products as well. So all of that, absolutely all of that. Go to safecosmetics.org, EWG.org. Those are great places to start. World of information.
One of the things I have to say about shampooing is I think there's kind of a mania for shampooing, and I don't think that it's necessary to shampoo your hair every time you go into the shower. I think that, it may be important for hygiene, to wash yourself
Mhm.
off, and,
Mhm.
avoid BO, and,
Sure.
right? But when it comes to shampooing, I don't shampoo very often. I may shampoo,
Yeah.
after I've been doing a fair amount of swimming and I feel that the chlorine is accumulating in my hair.
You want to rinse that away.
Yeah, is that there's some residue that, makes my hair feel
Yeah.
kind of, tacky or something, then I'm just going to clean that off. But
Yeah.
you deprive your hair and scalp of the natural oils, strip them
Mhm.
away. And, I'm thinking that's not that great for
That's
your hair.
not best either, because then people start complaining about dry scalp itching.
Yeah.
Well, if you're going to shampoo that often, and I don't shampoo that often either, I agree with
Yeah.
you have to kind of watch and use something very, very gentle.
Mhm.
And that's not stripping all of that away, because that's your natural kind of your oils and everything. It helps with the sheen of your hair and so forth and so on. And you'll know when it's time to shampoo. You'll kind of feel it.
Yeah, exactly.
So you'll kind of feel it.
When you break the
So-
comb, that's time to it's or like when large chips start to fall onto your,
Yeah.
jacket.
Another example of this about now shampooing every day, I've heard people say, especially as I was growing up, when we're teenagers, when we're oily and everything like
Yeah,
that, with
yeah.
changing hormones and everything.
Yeah, yeah.
I have to shampoo my hair every day. I'm so oily. Well, when you're rubbing your scalp like that, you're activating those oil glands as well to secrete more oil.
Oh,
So the more
you actually
you're doing
accelerate
that, you
that
make
process.
it, yes,
Yeah.
yes,
Because
yes, yes. So you want to take it easy on all that
yeah,
and not use anything strong. Something. So,
because soap is a detergent. It's a detergent.
it's a
Let's face
detergent.
it, that's what it
Exactly.
is. Yeah.
Exactly. Exactly.
Okay.
And again, you could go in there and just rinse and wash with water and maybe condition one day, shampoo on other days. There's, water is good. Yeah.
Yeah.
Okay. Tony, thank you for that question.
Shall we allow one of our sponsors an opportunity at this point to share some information? Let's do that.
Absolutely. Yep.
Okay. Here goes.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out xlear.com for our special offers. That's xlear.com.
Thanks for listening. Thanks for supporting our sponsors. They are what make intelligent medicine a continuing free resource to you, and we appreciate their support. So, what's next?
We've got a question here from Michael. I'm 82, male, and out of the blue, began to experience severe back spasms, pain in my lower back. Not sure what triggered it. I take a wide variety of supplements, including Boswellia, curcumin, PEA, tart cherry powder, other anti-inflammatory things. No difference so far. I do a variety of stretches, yoga, Tai Chi. I do have an appointment with the physical therapist. I use heat. I use ice. Friend suggested a TENS unit, which has helped her. Would you be able to comment?
Can be helpful. Yeah, can be helpful for spasm. Yeah. Usually these are self-limited episodes. And, you may want to get an evaluation to see if there's something critically wrong. Like, maybe since you're already seeing a physical therapist, maybe you've already seen a doctor who's done some sort of evaluation, maybe some imaging to see if you have, say, a vertebral collapse, like a, vertebral fracture or a disc impingement. Not that I would recommend surgery as the immediate option, because all too often surgery is undertaken that when physical therapy and tincture of time alleviates the problem. So the
TENS unit that Michael is asking about, TENS stands for transcutaneous electrical nerve stimulation.
It delivers a little
voltage.
bit of a shock.
Yeah.
And, there are smart TENS units that can be calibrated to specific frequencies that seem to be helpful for muscle spasm and, can provide what happens when electricity is administered to tissue. Sometimes it helps bring blood into the area, improve healing. Also TENS is kind of it is kind of like fighting fire with fire. It's a little like when there's a fire, you set up a fire break. It's a distraction kind of thing where if you apply an impulse and you feel it, it distracts you from the pain, so temporarily maybe breaking the cycle of pain. I think physical therapy is excellent for this.
Yeah.
But, usually physical therapists, if they don't know what's going on and if the pain persists, they'll say, maybe you should see a spine surgeon. Not that you need surgery, but just to figure out what the heck is going on.
Yeah.
But the one thing just to keep in mind, don't, it used to be thought that if you have a back spasm that you just lay down, they put people in traction, they immobilize them, They put them in body casts sometimes. And that's the worst thing you can do. It turns out that you should really, and this is what I try to do, because I occasionally, I overdo it, my back hurts. I make sure that I keep moving. And I keep stretching. I'll do the child's posture. I'll do
pose.
some,
Very
I'll
good.
get on my back and I'll, grab my knees, like what's that called?
Baby, happy baby pose.
Yeah, and
Grabbing your feet up in the air.
Yeah, that kind of thing. And sometimes kickbacks, sometimes bridges,
Yeah. Or,
I mean,
even
this is part of the price that we humans pay for something very unusual in the animal kingdom, which is walking upright on 2 feet.
Right.
It's very
I just
unusual.
want to also rule out the obvious. Michael, does your mattress need changing? Are you using the same mattress for 20 years? It may be time for a new mattress.
Yeah, I wonder though, if that's not just a sales ploy to sell more mattresses, because, when I walk around New York City in the winter, I see these guys sleeping on grates on cardboard, and they sleep fine. Now, I don't know what substances they've taken, whether it's alcohol or drugs, to enable them to sleep outside in the cold on an iron grate with just a mattress of a cardboard box.
Yeah.
But, I'm not sure that
A firm surface is better than something too soft.
Yeah. Right.
Or something like that. That could be it. Okay. Michael, thank you for your question. We hope you feel better. Keep in touch. Okay. Let's see. Gail writes, I'm ready to ask, what is the best vitamin C my husband and I should be taking? We're both 78 years old.
The best vitamin C?
Best vitamin C.
Mm-hmm.
We're both 78. What dose, what brands is Ester C still the gold standard?
Yeah.
What do you think?
I have to say, I used to actually voice Ester C commercials. I was the first, physician endorser of Ester C for a company called Natrol, which made Ester C back in the 90s. And what was weird is it was all over the country on syndicated radio, not just on my radio station, but people in South Africa were telling me that I hear your commercials here. It's international. So, so I used to think that Ester C was the most bioavailable form of vitamin C.
Yeah.
That was the claim, and there was some science to it. But I've become less convinced that Ester C is more bioavailable. And I think one of the ways to overcome that is, if you're taking 250 milligrams of Ester C, and you want the equivalent, just take, 500 milligrams of buffered vitamin C.
Yeah.
I think the buffering is useful because it's less caustic, that's going to cause less esophageal discomfort or stomach discomfort. But I think vitamin C is one of those things that just, it's a commodity. It's just, I don't think that they've come up. Then there's also the, what's that fat soluble vitamin C? What's it called?
Yeah, liposomal vitamin C.
That I don't believe in at all. I don't really see the advantage to that at all, because
C is a water soluble.
It's water soluble. So how are you going to put it in a liposome? Why is that? I think it's a gimmick, a marketing gimmick.
Yeah.
And it makes it more expensive supplement.
Yeah. The buffered vitamin C that you're talking about, Dr. Hoffman, people are able to take it in between meals. Here's the thing.
Yeah.
And I remember the late Andrew Saul, I believe, talked about this, and it really made me examine my own use of vitamin C at the time. If you're taking buffered vitamin C, you can take it in between your meals, not with, which is good. Because for those people who have a lot of iron or high ferritin levels, not due to inflammation, but too much, vitamin C, if you're taking it with your meal that has a lot of heme iron in it, a steak, a burger, a chicken thigh, that will enhance the absorption of the iron even more. So there are some people that need to watch that. And
or it can be, alternatively, it can be a trick for people who are low iron to enhance their absorption of the iron. Yeah.
Exactly. So buffered vitamin C, either one of those. I actually take both. I've got that. I've got ester C. I've got different types of vitamin C that I kind of ring around the rosy with. And plus I'll eat an orange and chop up a red pepper and strawberries and things. There's vitamin C around. So,
well, you won't get scurvy.
It's important.
But they do say, by the way, they do say that scurvy is recurring. It's making a comeback, especially among diabetics, because their demands for vitamin C are greater. And if they're on a really crappy diet, we actually see, what is essentially an 18th century disease emerging in hospitalized patients sometimes.
What's interesting? High blood sugar antagonizes vitamin C.
Yes, absolutely. Mm-hmm.
Yep. And that's why diabetics actually need more of it.
They compete for the same receptors, yeah. Mm-hmm.
Yes. Yeah. So that's very important. And another thing, which is interesting, that scurvy, even the low level, under the radar, subclinical scurvy, may be responsible for the calcification in coronary arteries. Mm-hmm. Could it be that with so much diabetes, those folks with high blood sugar, they progress 70% faster to coronary artery calcification than those with normal blood sugars? Could it be that there's a little low-level scurvy happening because the vitamin C is being antagonized, or the poor diet overall, and they're not getting any vitamins?
Well, we know that that's at least a theory, that there's a vascular element to scurvy. That's it does involve the blood vessels. So
Mm-hmm. Who knows? And we do know also that taking vitamin C helps to keep the blood vessels more elastic. Mm-hmm. Now we're talking taking some vitamin C or having enough vitamin C to keep, to have that happen so that the arteries.
Yeah, we generally don't think of it as a cardiovascular vitamin. It's more of an immune system supporting, but it has effects on connective tissue throughout the body. So yeah.
Oh, and another thing occurs to me about vitamin C is it helps to recycle vitamin E, and I believe vice versa. To some degree. So if you're eating your oranges and sesame seeds and nuts and things, and you're getting vitamin E and you're getting vitamin C, okay, that's good.
It could be one of the reasons why some of these vitamin E trials fail, because they just give vitamin E and they say, don't take anything else. And that maybe that what we need is a suite of antioxidants working together, replenishing and renewing each other, working together, and which is what they do in nature.
And all of these old studies that they looked at when they did their meta-analyses and all of that, so many of those studies, the majority of them use only D-alpha tocopherol as vitamin E in that particular research, which we know taken on its own is actually dangerous.
Yeah, because it actually competes with the others. Coming back to the vitamin E story. Okay.
Yeah.
Right.
Okay.
We have time for an additional question.
Oh, okay. This comes from Michael. Which brand of PEA is the most bioavailable? Now,
so what is PEA? PEA is, I got to get the pronunciation correct, so I'm going to look it up.
Oh my gosh.
This is, all right, here we go.
Mm-hmm.
PEA, the expert on PEA that I have on frequently, and he's written a book on pain. New book that's just come out is Dr. Jacob Teitelbaum, who is an expert on chronic fatigue syndrome and fibromyalgia, but he's now written a book on pain. He has books on long COVID as well. And he has a nice article at vitality101.com. That's his informational website. PEA, a key pathway to discomfort relief. And he has a new edition of Pain Free 123, which is one of his books. Okay. And so he actually makes a specific recommendation for PEA. PEA seems to be helpful for many types of pain, inflammatory pain, nerve pain. And he recommends starting, I'm reading from his website, so I can't claim credit for it. Start with 1,200 milligrams per day for chronic discomfort. That's a fair amount, because many of the brands that I see on Fullscript, it's 300 milligrams. The
So 4 a
brand that
day.
he likes.
Mhm.
The brand that he likes.
I think I know the brand. Healthy Inflammation
Yeah, called
Response.
PEA Healthy Inflammation Response, which also contains a proteolytic enzyme called serratiopeptidase.
Mm,
And he
okay.
likes these kind of high doses. So it could be pricey because let me see what's in this particular supplement here.
Okay.
PEA Healthy Inflammation Response, which has, what's it got in it? Well, now I can
Some good
pronounce
stuff.
it. It's palmitoyl ethanolamide.
Oh,
Palmitoyl
boy.
ethanolamide.
I'll just call it PEA.
I'll just go back to calling it PEA. That's what I'm fine with that. But I'm trying to see the dosage. Supplement facts. Okay, supplement facts. Oh, it's got 600 milligrams of PEA. So that's actually pretty good because a lot of the ones
Okay.
that are listed on Fullscript 100 or 300, this is 600 milligrams. So he says his protocol is start with 1,200 and work up to, that would be 2, and work
Yeah.
up to 4.
Okay. Terrific. And that will be how to take it, Michael. All right. Okay. So Vitality 101 is the website. If you want to read more from
Yep.
Dr. Teitelbaum.
And he says, don't expect instantaneous results. It's not like, taking an Advil.
Yeah.
It's not fast acting. It takes a cumulative effect that occurs over 3 to 12 weeks. And so, yeah, I mean.
Okay. Okay. Good to know. And a reminder to everyone, because we're talking about supplements, you can shop hundreds of curated vetted supplements in Dr. Hoffman's Fullscript dispensary. Just go to drhoffmanstore.com. That's drhoffmanstore.com. You can begin with Dr. Hoffman's recommended kit. Start with the starter kit, as it's called, and then expand with additional protocols tailored to your particular health concerns. It could be allergy. We're coming upon allergy season, so this might be a good time to start boning up on that a little bit. Speaking of boning up,
Speaking of boning up, yeah, right.
Boning
good
up, bone
good
health.
segue, Leyla.
Brain health, detox, heart, immune, sleep, and stress. Buying through Fullscript offers fast free shipping and optional refill reminders via text or email. Remember, drhoffmanstore.com is the place to go.
Okay. Well, thanks very much for joining us. By the way, what you writing about this week? You wrote something about second opinion on taking cholesterol drugs.
Yes. LDL, my LDL remains high. And what do I do about it? For example, LDL remains high, but they're not taking into consideration that the ratio is better because HDL is also increased. The LDL turns into a better particle, a big fluffy boy pattern A.
So don't steal your own thunder. They should read the article.
Yeah,
It's at
they should read the
drhoffman.com.
article.
And
because I get this question so much. My doctor still wants me on a statin because my LDL is high, even though everything else is beautiful. Beautiful lipid profile. But, and I go into detail about what to look at and what to do and what to discuss with your doctor.
Yeah, indeed.
Yeah.
But there's a treat in store for you. Also something that I wrote. You haven't seen it yet, but since it's my 40th anniversary on radio, I started in 1986, 2026. I constructed a timeline of things that have happened in medicine and health that have been impactful over the last 4 decades. And it's quite a nice little trip down memory lane in terms of some of the things that have had a big impact on the health scene. Obviously big momentous events like COVID, but, we tend to forget about things like mad cow disease and Ebola.
Oh, yeah.
And,
oh, my gosh.
I even mentioned the debut of the Dr. Oz show, things like that, cultural events that kind of shaped our feelings about health and medicine. So, okay.
I used to watch Dr. Oz's show back before Oprah kind of discovered him, so to speak.
Yeah.
On all the various supplements and things. It was a very kind of small show on cable, but it was very nice.
Oh, okay.
I remember that. Yeah.
Well, before he had a TV show, he was a frequent guest on my program. And, and I knew that he had his eyes on, because he was really good. And, just doing a little bit here and there, itty bitty radio spots, that wasn't enough for the talented Dr. Oz. And so Dr. Oz went on to TV fame, and now he heads up Medicare and Medicaid. And he's just a jack of all trades, an articulate guy. I knew him when he was a surgeon at Columbia Presbyterian. He was a cardiothoracic surgeon. And in fact, one day, I was working with a physician's assistant. She said, I have an opportunity to go see Dr. Oz in the doing an operation, and he's going to let me scrub in, and I'm going to wear a mask and gown and everything, and I'll just stand in a corner and watch. And so she came back from that afternoon, and I said, how'd it go? And she said, well, it was kind of weird because it started out like they were playing classical music, and then they all stood around by the patient, and they said a prayer, invoking a positive response. And then as the operation proceeded, all hell broke loose because there was something that went awry, and it was like, oh my, because things happen in surgery, and it was like they were swearing and the curse, it's like you can you can pipe in all the classical music you want. They're just white knuckle driving moments during surgery where just but not to say that he wasn't a fabulous surgeon. It wasn't his fault that stuff happens during surgery. But anyway, Dr. Oz, congratulations to him, because he's had a wonderful career, and he's been for the most part, a positive influence on this field. All right, good stuff. So read the newsletter article, listen to our podcasts. We got lots more in store for you as Intelligent Medicine listeners. And I know you're out there, because when we posted on social media, that was my 40th anniversary. I got a lot of really nice congratulations, and people who said, I've been with you since the start. Oh my goodness, we've aged hopefully gracefully together, 40 years.
Yeah.
And I haven't killed off some of those people.
Thanks, Dr. Hoffman. Thank you, everybody.
Very good. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muden, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.